In March is Colorectal Cancer Awareness Month, and doctors, they say there is still a lot of confusion when it comes to screening. A new survey from MedStar Health highlights some common misconceptions. And joining us live this morning is Dr. Stephen Wexner with MedStar Health to help set the record straight. Thank you so much for joining us.
Thank you very much for inviting me.
Just a little background here. You're a physician executive director and system chief of colorectal surgery from MedStar. A lot of expertise this morning, so we do appreciate it. Let's start with the basics here, because this is where there's been some confusion, and we know we've lost people at younger ages than when they said you should get screened. So at what age should most people begin to get these colon cancer screenings?
Excellent question. Screening colonoscopy saves lives for sure. The standard screening age is currently age 45 in the absence of any symptoms, in the absence of any family history. 45 is thought to be the starting point. I suspect that age will be challenged as we're seeing more and more younger patients under age 45 getting colorectal cancers.
How often at that point, if you start at 45, and I guess it depends on what they find, but how often should you get your colonoscopies?
So if we're talking about somebody with no family history, no symptoms, following the standard guidelines, it's a range that's offered of every 5 to 10 years, which is really contingent upon some other factors, but assuming no polyps are found. And that's the beauty of colonoscopy. It is one of the only tools we have across all of medicine that allows us to prevent cancers. It's not just a matter of detecting them early. We know that the vast majority of cancers come from small growths called polyps, and those small growths or polyps can be identified and safely removed during colonoscopy so that cancers don't develop.
What's the biggest misconception that you're still seeing right now?
Well, there's a couple, and particularly our survey found that 77% of the 1,000 people who responded to the survey did not know that 45 years of age was the appropriate age at which to start screening colonoscopies. Moreover, 36% of patients who were eligible for colonoscopy didn't have a colonoscopy. And the reason most commonly cited in the MedStar Health survey was because they said, well, I don't have a family history. If you had a family history, your screening, in fact, would have started or should have started 10 years younger than the youngest first degree relative with colorectal cancer. So there's a lot of misconceptions that are out there. 75% of the respondents didn't know how often to get a colonoscopy, and 47% thought it was one every 5 years. So there's a lot of misconceptions out there.
And for people who are nervous about the method of colonoscopy, there are different screening options available today, right? What should we know?
Well, the other screening options certainly exist, and they are based on what's found in the stool, and sometimes they can detect cancers. In fact, they have a high level of accuracy. I don't believe it's 100% accuracy, and that's the problem. So yes, you avoid a colonoscopy, and you can avoid what most people don't like is the bowel preparation prior to the colonoscopy. The colonoscopy is done under sedation and as a quick outpatient procedure. So instead, people try and get this fecal immunohistochemistry done, which is a fancy way to say we can see if maybe there's something wrong by what's in your stool. The problem is, if it's positive, a colonoscopy is absolutely needed to ensure that that's a true positive and to identify and hopefully remove any precancerous growths or worse yet, unfortunately, maybe detect a cancer. The issue that's concerning is if it's negative, is it really negative? So in my mind, for me, my loved ones, my friends, I think screening colonoscopy is still the best available method of evaluation, detection, prevention.
Just invaluable information. Quick note, more than 50,000 people are expected to die from colorectal cancer this year. So get the screening, save a life. Thank you so much, Dr. Wexner, for your time.
No, I very much appreciate it. It's actually now the #1 cause of cancer death in people under age 50 as of this year.
My goodness, get screened. All right, thank you so much.